Welcome, everybody, to the Reach Student Program's Career Chats video library. We've got an excellent interview for you today, but first, let me remind you about all of the Reach student programs that we offer. And by the way, all of these student programs are absolutely free to students in middle school and high school. Gulf Coast South AHEC covers the counties of Charlotte, DeSoto, Sarasota, and Manatee within Florida. You can see our career pathways programs that we have on the screen here. It can begin with the Health Careers presentation video, which is on our website to give you an introduction into the many different types and varied types of health careers you can choose from. Career Chat Video Library is also on the website. Career camps we offer in the summer to learn more about health careers. I also work with HOSA, Future Health Professional Partnerships in the schools in our 4-county service area. We have a Reach Public Health intern program for college students and high school students. And then, of course, our crowning glory is our Florida AHEC Scholars Program, which is an intensive 2-year program for graduate level students in college. So we have plenty of free student programs that you can take advantage of. Today, my interviewer is Jackie, who's one of my interns. Go ahead and introduce yourself, Jackie.
Hi, my name's Jacqueline. I'm a public health student at Florida Gulf Coast University in Fort Myers, Florida, and I am a public health intern at Gulf Coast South AHEC. So today we have a special speaker. Her name is Miss Yareli Trejo. She's a licensed registered nurse who's currently working as a registered nurse in the Progressive Care Department at Lee County, Florida. We'll begin with a video on an overview of what registered nurses' careers are like.
A progressive care unit is a step down from ICU, but a little bit higher acuity than your patients that are off the monitor. We see a little bit of everything from patients that are just being observed overnight and are generally in a pretty good state of health to patients that are really, really sick and are just one step away from needing the kind of interventions that you would see in the ICU. We see a huge variety of patients on my unit. We see general surgical patients, we specialize in stroke patients, we see neurology patients or neurosurgery patients that have had various procedures done. We take plastics patients with flaps and monitor the status of the flaps. We take head and neck patients that have had new tracheostomies placed or had different procedures done. We also take trauma overflow, medicine overflow, so really no day is ever the same on my unit, and that's one of the things that I love about it. Typical things that we do, there's central lines being placed at the bedside sometimes. We take our patients off unit for CT scans, MRIs. As a nurse at the bedside, you're doing assessments, sometimes as often as every 2 hours to assess for neurological changes in the condition of a flap. If you have a plastics patient, you're checking for pulses sometimes every 2 hours on those vascular surgery patients. But what I really love about it is no 2 patients are ever the same and no 2 shifts are ever the same. You're really doing something different every single night. Well, I usually like to get to work about 15 to 30 minutes early, depending on whether I was there the night before or not. That way I can get a sense for my assignment, I can look up my patients, write down their name, their allergies, a list of diagnosis and procedures that they've had while they're in the hospital, and just kind of get a general outline of what my night is going to look like, what I need to prioritize, things like that. I also like to look at lab values to just quickly review before I get report from the oncoming nurse. That way, if I notice something that seems really off, I can see if that was corrected in the daytime, if we need to do a redraw to check if the correction worked or not. Those are kind of typically the things that I do before I actually clock in. And then once I clock in, I obviously get report. We go and round on our patients, introduce myself, and that usually gives me a pretty good sense of who my sickest patient is and whose room I really need to be in first when I go to do my assessments. Some patients, if they're not that sick, I feel like I can wait until I go do my med pass, maybe a little bit after 8 o'clock to go see them. But if they're a really sick patient, then after I finish getting report, by 7:30, 7:45, I can be in the room and do a full head-to-toe assessment to analyze if there's going to be any problems that I need to get on top of right away. One of the things that I do like about night shift is we have great camaraderie, great teamwork. Everyone on nights really sticks together because we do have a lot less resources than on the day shift, but at times that can also be a challenge because we don't have transport, we don't have an IV team, we have to pretty much rely on ourselves and on our coworkers. One of the things that is obviously challenging about night shift is adjusting and managing your sleep schedule, both on the days you work, but also on your days off. It can be really hard to turn around and live a healthy, normal life and enjoy that life-work balance outside of work when you're working nights, 3 12s a week. So that can be a big challenge, but overall what I like about nights is the teamwork that we have and that you do sometimes have a little bit more time in the middle of the night to sit down and really get to know your patients. I mean, the biggest thing is probably just time management. You have 3 to 4 really sick patients on my unit. A lot of the time you have 2 or maybe even 3 patients that need a lot of your attention. So you really have to be able to prioritize what room you need to go into first, what task you need to see to first, and then if you can delegate or hand anything off to like your resource RN, your CNA, anything like that, any extra hands or help that you can get depending on the kind of night you're having. So that's probably the biggest secret, but it's definitely something that takes time, definitely something that just takes experience to be able to learn what really needs your attention right away and what can maybe wait a little bit. I would say a PCU is a great place to start just because you will see everything and you will learn how to interact with patients from every walk of life. So if that's something you're interested in, a big thing I would suggest would be trying to get your foot in the door in a progressive care unit just by working as a CNA, some kind of a care tech. We have a lot of new grads who have been really successful and done really, really well, who transitioned from being CNAs on our unit to RNs once they got their nursing license. And I think they found the transition to be a lot easier because they already know our staff, they've built up a good relationship with all of the nurses that work there, and they just kind of know their way around the unit, know the type of patients. So that's probably one of the best things you can do. And even if you end up working in a different place, you still have that resume item of having worked in healthcare throughout nursing school, and I think that's super invaluable.
So typically when you think of a registered nurse, you can think about a hospital, patient care, or maybe even their uniform. However, nurses, they do so much more than that. They're like the backbone of healthcare. And I know that they probably went through a lot, especially during the pandemic. Like many other medical workers, registered nurses do a lot of hands-on work with patients, and they must be great communicators. So today we're going to learn more about registered nurses by having Ms. Trejo share some of her answers with us in regards to her experience as a registered nurse. So my first question would be, what is your job description like?
So we check the patients. So it's the job title is so broad depending on what you're doing, but the basics are you go, you do an assessment on the patient from head to toe initially, just to get to know them, and they show you that in school. And then after that, you just keep rechecking throughout the day just to make sure that they're okay. You do medication administration, you work with other people in the field, example, doctors, physical therapists. So you just work with other people to take care of the patient with quality care. We go from documenting, we manage different treatments, we can do wound care. It just depending on what you're doing, but those are the basics. Just working with other providers to help take care of a patient and their health.
Yeah. So so the work, what is the atmosphere like?
There's different settings.
Okay.
There's not just one, but in my case, I work in a hospital, and I like working there because it has to be teamwork. Everywhere that you go, most likely all the nurses are gonna be very good team players. Um, they have rooms, they have the patients, depending on what setting you work at. But where I work, the setting is just fast paced. Everything can change in a second. So not like the emergency department, that's a little bit more intense, but this is like fast paced. You have to be thinking all the time. You do get little breaks, right? But um, it's fast paced, most of it, and you just try to stay ahead of everything. That way, if something was to happen, you are prepared and you have that time. But the pace is high pace.
Okay. I know you kind of mentioned it before, but so what health professionals do you work with in your career?
So I work with doctors, nurse practitioners, physician's assistants, respiratory therapists, occupational therapists, physical therapists, speech, um, certified assistants, pharmacy. We just work with everyone in the hospital.
So, okay. So what kind of patients do you work with in your career?
So I started my career right after high school. I started as an LPN. So I worked with, I used to work in an orthopedic office. So it was a clinic. So I worked with patients that had bone problems, either, through old age or injuries, hand traumas. And then I worked at a nursing home, which is more of long-term or skilled nursing, that's what it's called. And the patients there are just older adults that are in there for therapy or for just to live there, and that we can take care of them. That's another setting that I have worked. And then I currently work in the hospital. So that's just from 18 to 99. I guess that's what be like
All
the
age,
old
yeah.
age. It's
Okay.
I have never worked with kids. I think the youngest person that I've taken care of was 17 years old, and they ended up in our hospital. But they do have a children's hospital, so that's the youngest person I've ever taken care of.
That would be separate, right? Like pediatric?
Yes,
Yeah, okay.
anything under 18 is pediatric. Some hospitals do 21 and under.
So what is a typical day like?
So in the mornings, you wake up early. So there's different places, but where I currently work is 12-hour shifts. There are some places that do 4 hours. There are some places that do 8 hours. I do 12 hours. So in the morning, I wake up, I go to the gym, try to stay healthy, take care of yourself. And then after that, I try to be at the hospital 15 minutes, 30 minutes before, if it's my first day, just because I want to look at all the charts, and in case I have any questions, I can ask before I see the patient, and before I get a report, just in case there's something that needs to be corrected, we do that. Then if someone's very sick, you go see them first. You do a head to toe assessment. Initially, you go introduce yourselves. And I guess I just gave this out of order, but you introduce yourself first. You make sure that your rooms are all organized and everything's the way it's supposed to be. And then you do your assessment, you do your medication pass, and if there's any treatments, you do treatments in the specific unit that I work. If you're in certain medications and the patient has a procedure, that means that they're going to leave the floor. You have to go with them. So that means you have to get someone to cover your patients in the meantime, but you don't want to be like also a burden. So you try to do as much for your patients as possible. So you just have to prioritize. And then we help them if they need feedings. We do have CNAs that they feed them. We have other coworkers, but we also try to do it. If someone needs to be changed, we work together to change their their clothing, if they need to be changed, if they need to be groomed, any daily activity that they're not able to do, we try to help them with. And then, yes, and then you also take a lunch in between everything. You do manage. I manage my lunch in the mornings. I set a time of what time I'm going to go to lunch, because if you don't set a time to go to lunch, you might not go to lunch because you lose track of that. And then you have 12 hours to take care of this patient, and before you leave, you give report to the next nurse that's coming in. I have only done day shifts just because I don't know if I can stay up later than 12 or 10.
Yeah. So you did mention you work 12 hours, 12-hour shifts per week. How does that impact your personal life?
Well, so nursing is so flexible. Some nurses work 5 days a week, some work 3-day shifts, which is the 12s. And then some work 10-hour shifts. So that's 4 days if you just want to work 40 hours. Some nurses like to do overtime, so they just work extra hours. And some just work as needed, per needed. So they work once a week or whenever they need them. If you can also make your own schedule. So I currently go to school. I'm trying to work on my doctorate. So I work Friday, Saturday, and Sunday so that I can have time the whole week to spend time with my school, my children, my family. So the weekends are good.
Yeah,
I
that's
work
nice.
3
Yeah.
days. Yes. So it does impact the time I spend with them, and my children are home on the weekends, but at least during the week I can get them up, get them ready, play with them, and I'm more flexible with my weekdays.
So what type of starting salary can a person expect in this career?
I started in 2006.
Oh,
So I was a licensed practical nurse. I started at 18, $18, and that was just my practical nurse. I think at that time the nurses were starting at 24. So when I started, I graduated with my registered nurse in 2018. It took me time to graduate, but based on that experience, I wouldn't be able to know the initial salary, but I think it's like around 27, 28 with no experience. With more experience, you're in the 30s. With the pandemic, the pay did go up, and I'm not sure how much. I think it's in the 30s initially now, depending
so
on the hospital you work for.
okay, that's great. So why did you pursue this career?
I think it's a calling. I think it calls you instead of you choosing it. I think that's how it works. This is a career that kind of chooses you. You don't go into nursing thinking, oh, I want to be a nurse, or maybe you have someone in your family that was a nurse. My mom was a nurse when we were in Mexico. I'm from Mexico, so she was a nurse there. My sister wanted to be a nurse, and I wanted to just help the community. I wanted to do something that would help the community. I always wanted to be like, someone that made a difference, but I didn't know what to be. So I went for nursing initially, just to see how it was, and then I fell in love with the career. I think that it chooses you because sometimes you don't even know that that's what you want to do, and you just love it so much because you're making a difference. If you like making a difference in people's lives, then this is a career for you.
So what would you say is the least satisfying thing about your career?
The least satisfying thing of my career is now we do a lot of charting, and and I understand why we do the charting, but it sometimes takes away from what the time that you're spending with the patients. And then depending on what setting you work, we do have patients that are very sick mentally sometimes, and they do try to be aggressive, or if someone has like a mental illness, sometimes they try to hurt you. Not all the time, and there's always resources that you can call, but I think that's the least satisfying part of it, that sometimes you can be like, if someone's confused, they might throw a spoon at you, they might think that you're trying to hurt them even though you're not. So you always have to be on your toes, but I think that's the least satisfying part.
What's the most satisfying part?
Just seeing someone smile. I think that pays more than, that makes me feel better than getting a paycheck, if it makes sense. If someone's very sick and I just see them smile, that makes my whole day go better, knowing that I got someone to smile, even though they were very sick, or they're having a bad day. If I can get them to smile or just be comfortable, then that's the most satisfying part.
So what education and or training was needed for your career?
So I did the untraditional. Traditional is you go to a university, you do your pre-nursing, you do your associates or your bachelor's, and then you do the testing, and then you can practice. I did a CNA program that was I think a month or 2 weeks. I don't remember it, but I did that. And then I did licensed practitioner nurse, which is you're limited to what you can do or medications that you can give as a nurse, but you still take care of the patients. I did that. That was a year in a technical school. And then I took prerequisites part-time in my college, county college. And then once I had my prereqs, I applied to a university, and that took 2 years, and I did my bachelor's. And then I took the state test that you have to take to get licensed, and then you can practice.
So what you did mention the college and university you attended. What was the atmosphere like over there?
So nursing is usually taught by other nurses or that have chosen education as their field, and they're very supportive. They try to guide you as much as possible, and they give you all the resources that you need. My first program, which was an LPN, it was taught by RNs, and I think they had their masters, and they were very supportive. They wanted you to know, because they want you to be able to do the best practice that you possibly can. And what if one day you're going to take care of them? So they have to prepare you for taking care of a patient well. And so I've had good experiences with my schools. All of them have been very supportive. They are fast paced. They do require to study long hours, but you're taking care of a patient, you're taking care of a life. So it's not just passing a test, but you're going to take that into your career. You need to know the information to take care of your patients.
How did you pay for your education?
So the technical school, they gave me a grant. There's a lot of grants out there. They gave me a grant, and that's how I went to school. My pre-nursing, I paid by myself, and I saved for 1 semester, and then I will work, because now you have the flexibility of working as in a job. So I use that money to pay for my pre-nursing for every semester. And then for my bachelor's, I did take out a loan. I could not work and go to school full time. So I did take out a loan. And at my last semester, they gave me a grant for 1 semester.
Would you like to share a story about an interesting case you had working on or a patient that made an impact on your life?
I think that every patient makes an impact in someone's life, but one patient that did make an impact in my life was a patient that had cancer, and this is in my early career. They had cancer, and I think I was like 19, 20 years old. Now you can know my age, but they only spoke Spanish. So I had to translate for them. I was their nurse for like 9 months straight. And this patient, you're scared, you don't know the language, you're in a different country, you don't know the treatments, but they ended up being okay at the end, but going through the whole process of taking care of them, not just as a patient, but now you get to know them. And at the end, he did say thank you. And I see him on the streets, and that makes me so happy because he was able to be better and I was able to be part of that. And he might not remember my face now, but you know that you made a difference in their lives. You made their journey, even though it was hard, you made it easier, or at least you were part of that team that made it easier, even though it was during hard times.
So what's the best piece of advice for students interested in this career?
My best piece of advice would be go for it. Nursing is so enriching, not only to your life, but you do make a difference in other people's lives. There's so many paths that you can take. There's so many opportunities. There's different branches that you can do. The hours, you can choose your own hours in some places. There's so much flexibility. If you're going to do this career, you need to do it from your heart. There's other careers that make a lot of money. This career, if you do it, you're going to be a different person at the end. You might not make millions from this career, but it is very enriching. And I guess if you're going to do this career, just do it if you really love it.
Well, thank you so much. I appreciate you being here, Ms. Trejo, sharing with us today, answering all of our questions. I enjoy hearing about your journey, and I believe this interview will give students a better understanding of what it means to be a registered nurse. So thank you so much.
Thank you for having me.
And I thank you so much, Ms. Trejo, for joining us as well. And I love hearing about your journey. This is one of the favorite things I do with these career chats, to hear how everybody made it through school and how they picked a career. And sometimes it's not a straight road. It's usually a long and winding road. And you obviously love it. And it's important for students to understand that when you have a healthcare career, you're going to be caring for people who are sick or ill or injured. You're going to be meeting them on probably what might be one of the worst days of their life. So they're not necessarily going to be happy. And so when you were telling the story about they might throw a spoon at you, I love it when you share that, because it's important to understand you're taking care of people that don't feel very good, and you got to cut them some slack, don't you? For sure. Thank you so much. And as a reminder to everyone watching, I am Joan Dixon, Director of Student Programs at Gulf Coast South Area Health Education Center. Please note on your screen right now, as a reminder, the 6 free student programs we have. We have our website listed at the bottom, my phone number, and my email. If you have any questions, please feel free to reach out to me. Thank you so much for joining us today. And I appreciate your time with my guest interviewer, Jackie, and my guest interviewee, Ureli. Thank you so much.